amount,
so that's
and that is a very important point. That's why the criteria has to be clear on who qualifies for this kind of relief.
And you know, the devil is certainly in the details and how they will be able to address intricately the details.
But in terms
inside.
of where the money comes from, actually the current president said we lose 2 billion per day.
Per day, yes.
Per day. So if you multiply it, then it
I'm
means...
happy you agree with me on that.
No, but we still have to know where that money went to. But because we just have just probably about 2 minutes, so let's just quickly also take a look at the second issue, which is, you know, Baba Care. Again, one of the most pronounced agendas during the campaign period and trail by Azimio. And also a key issue that I think you've both seen the residents of Mombasa talking about. He says about scaling up of the universal healthcare pilot programs across the country and widening. Okay, that's it. So the issue here then comes to, you know, the NHIF, which is already in place, right? So NHIF is, first of all, underfunded, and this is, you know, a huge, significant issue in the realization of the universal health coverage in the country. So then you look at Azimio and you want to ask, how will they be able to realize this agenda?
If you look at NHIF, 70% of the premium being paid goes into operations like paying salaries, rent, and the rest. And Raila Odinga's administration, let's say the team, the economic team, which will be unveiled to you maybe after this manifesto, have looked at how can you lower the amount of money that goes to operation, because I'm sure James can agree. If the 70% of premiums are going into paying salaries, paying operation cost, 30% only goes into healthcare, then there's a challenge. So how will you be able to deal with that to ensure that if the system is efficient enough to ensure that actually the money is given, like you said, the 6,000, who will ensure that that Wanjiku somewhere, Onyango somewhere gets the 6,000 and it is seamless? That's where execution comes in, because strategy without execution, that talking about how becomes a very important question for all Kenyans to assess, and most likely, because we are talking about decision 2022, I want to tell you, even if you don't believe in Raila Odinga's manifesto, ask yourself, whom can you trust with anything they promise? Because this is you are making a decision. You cannot make a decision between me and Raila Odinga. I'm not contesting. But the person contesting is Ruto versus Raila. With their manifesto, whom can you trust with, why, what, how, and who?
All right, Prof.
That's the most important.
Maybe also just quickly, James, as you wind up.
In my view, I think the Baba Care can easily ride on the infrastructure of the current wave. Remember, during COVID, the government really built quite a number of hospitals across counties to try and give them the capability to address the COVID challenge. So I think the Baba Care can ride on that infrastructure if they can equip the existing hospitals, then make it affordable. I think they already have a possibility as far as that is concerned.
All right. Thank you. James Shikwati, expert in development economics in Africa, and also founder and director, Inter-Region Economic Network, as well as Professor Fred Ogola, political strategist and director, Institute of Strategy and Competitiveness. Thank you so much, gentlemen, for coming in and sparing your time to discuss these issues. Of course, there's still a lot to be dwelt into, but that's it. That's all we had lined up for you this hour. Many thanks for watching. We'll be